Right? Ever wonder what all those numbers and percentages on your blood test results actually mean?
Well, today we're gonna
Today we're diving deep into the world of hematocrit.
Yeah.
It's one of those
A powerful indicator of your health.
It's one of those numbers that you see on your results.
Exactly.
And
it can tell us a lot about how well our bodies are functioning.
so to start, can you just explain to us what hematocrit is?
Yeah, so hematocrit basically it measures how much of your blood is made up of red blood cells.
Right.
And these are the tiny workhorses that are responsible for carrying oxygen throughout your body.
Okay, so it's like a snapshot of our oxygen delivery system.
That's about it.
But what does a healthy hematocrit level actually look like?
Well, normal ranges actually vary depending on a few factors.
Yeah.
Primarily age and gender.
I was gonna say, I don't think it's a one-size-fits-all.
No.
Right.
So, for instance, we generally see hematocrit levels between 40% and 54%.
Okay.
For adult men, while for adult women, it's typically between 36% and 48%.
Interesting. So right off the bat, we see some variation.
A little bit, yeah.
Just based on, those factors.
Yeah.
What about kids? What about babies?
Absolutely.
Do their hematocrit levels tend to be different too?
So for children, the range usually sits somewhere between 30% and 44%.
Right.
Although that can fluctuate a bit as they grow.
Okay.
Now, newborns are a completely different story.
Yeah.
They have the highest range, coming in between 55% and 68%.
Wow. So it's a big jump.
That's quite a range. Yeah, from men and women and even children.
That begs the question, what's the reason
Sure.
for those higher levels in newborns?
So, I mean, think about it.
Yeah.
They've just transitioned from an environment where they were receiving oxygen through the umbilical cord. Their bodies are adapting to breathing on their own.
Yeah.
So it makes sense that they'd have a higher concentration of red blood cells to maximize that oxygen uptake.
That's a really interesting way to think about it.
Yeah.
So if someone's hematocrit falls outside of these normal ranges, what could that signal? Let's start with high hematocrit.
Sure.
What might be happening in the body when those numbers climb?
When we see high hematocrit, it's often a sign that something is preventing the body from getting enough oxygen.
Okay.
So it ramps up red blood cell production to compensate.
So it's like the body is hitting the emergency oxygen button.
It is.
Right.
Yeah.
So what kinds of things could trigger that emergency oxygen response?
So sometimes it's something as straightforward as dehydration.
Oh, really?
When you're dehydrated, your blood volume decreases, making the blood more concentrated.
Right.
So even though the actual number of red blood cells may not have changed drastically, the proportion of red blood cells to the total blood volume increases.
Gotcha.
Hence the higher hematocrit.
Okay. That makes sense.
Yeah.
But you mentioned that high hematocrit can sometimes signal a bigger issue.
Yes.
What comes to mind?
There are a few possibilities.
Okay.
One is a condition called polycythemia vera.
Okay.
It's a rare blood disorder where the bone marrow,
Okay.
which produces red blood cells, goes into overdrive and produces way too many.
Okay.
This, of course, leads to a significantly elevated hematocrit level.
So in that case, it's not just a matter of the blood becoming more concentrated.
Right.
It's an actual overproduction of red blood cells.
Exactly.
Yeah, it sounds pretty serious.
It can be, yeah.
Are there any other conditions that can cause high hematocrit?
Certain lung conditions like chronic obstructive pulmonary disease or COPD can also lead to higher hematocrit.
Okay.
If the lungs aren't functioning optimally, it becomes harder for them to pull oxygen into the bloodstream.
Yeah.
The body senses this oxygen shortage and, once again, tries to compensate by churning out more red blood cells.
So it's like the body is playing catch-up.
Exactly.
Trying to make up for what the lungs aren't able to do efficiently.
Yeah.
Now, this is making me wonder if living at high altitudes could also have a similar effect.
You're spot on.
I mean, the air is thinner up there.
Yes. People who live at high altitudes often have naturally higher hematocrit levels.
Okay.
It's a physiological adaptation to the lower oxygen levels in the air.
Right.
Their bodies produce more red blood cells to ensure they're capturing enough oxygen with each breath.
So it's like, it's amazing how adaptable the human body is.
It is.
So it seems like high hematocrit isn't always a bad thing.
Correct.
It can actually be beneficial.
Absolutely.
In certain situations.
Yeah.
But I have a feeling it can swing the other way and become problematic too, right?
That's right.
Yeah.
Having a slightly elevated hematocrit due to living at high altitude is one thing. But when those numbers climb too high, it can start to cause problems.
I bet you're going to tell us about blood viscosity, aren't you? I remember that term from the research.
So think of blood viscosity as the thickness of your blood. When your hematocrit is high, meaning you have a high concentration of red blood cells, your blood literally becomes thicker.
So imagine your blood vessels as highways. Red blood cells are the cars traveling along. High hematocrit is like rush hour traffic.
Exactly.
Everything gets congested.
It does.
And just like in rush hour traffic, that congestion can lead to problems.
Yes. So the thicker blood doesn't flow as smoothly through the blood vessels, which increases the risk of blood clots forming. We call those clots thrombosis. And they can be quite dangerous.
That makes sense. It's like a domino effect. High hematocrit leads to thicker blood. Which increases the risk of clots. What kind of health issues can arise from those clots?
So blood clots can obstruct blood flow to vital organs, leading to a whole host of complications. They can cause heart attacks, strokes, pulmonary embolisms, there's a clot in the lungs, and even deep vein thrombosis, which typically affects the legs.
Wow, those are some serious consequences.
They can be.
So we've covered what happens when hematocrit levels are higher than normal. What about the opposite scenario? What's going on when someone's hematocrit is lower than expected?
Low hematocrit is often a sign that the body isn't producing enough red blood cells. Or that it's losing them faster than it can replace them.
It's like our little oxygen delivery system is running low on vehicles?
Exactly, That's a great way to think about it.
What are some of the common culprits behind low hematocrit?
The most common cause is anemia. Anemia is a broad term that encompasses a variety of conditions where the blood doesn't have enough healthy red blood cells to carry adequate oxygen to the body's tissues.
And I imagine there are different types of anemia.
There are. Some of the most common types include iron deficiency anemia, vitamin B12 deficiency anemia, and folate deficiency anemia. These types of anemia occur when the body doesn't have enough of the specific nutrients needed to produce healthy red blood cells.
So if you're not getting enough iron, B12, or folate in your diet,
that's right,
your body might struggle to keep up with red blood cell production. Are there any other health conditions that can contribute to low hematocrit?
Definitely. Chronic kidney disease is another possibility. The kidneys play a crucial role in producing a hormone called erythropoietin, which stimulates the bone marrow to make red blood cells when the kidneys aren't functioning properly. They don't produce enough erythropoietin. And red blood cell production can drop.
So it's all connected.
It is.
And I'm guessing significant blood loss?
Yeah.
Whether it's from an injury or an underlying health condition?
Absolutely.
Could also lead to low hematocrit.
Whether it's acute blood loss from an accident or surgery, or chronic blood loss, for example, from gastrointestinal bleeding, it can definitely impact hematocrit levels. The body loses red blood cells faster than it can replenish them, leading to a lower overall percentage in the blood. So with low hematocrit, we're talking about conditions that either hinder red blood cell production. That's right.
Or accelerate their loss.
Exactly.
I'm guessing this can lead to some noticeable symptoms, right?
You bet. When the body isn't getting enough oxygen, it sends out signals. Fatigue and weakness are common symptoms, as is shortness of breath. Some people even experience palpitations, which are those uncomfortable sensations of a racing or pounding heart.
Yeah, that sounds pretty debilitating.
It can be,
Are there any other, perhaps less obvious consequences of low hematocrit?
There are. One that might surprise people is an increased risk of infections.
Really?
You see, oxygen plays a critical role in immune function.
Makes sense.
When tissues don't receive enough oxygen, the immune system weakens, making you more vulnerable to infections.
Wow, I had no idea. that low hematocrit could impact the immune system that way.
Yeah, it's all connected.
So we've got a pretty good handle on what high and low hematocrit can mean for our health. But how do doctors actually use this information in a practical sense?
Okay.
I mean, what role does hematocrit play in diagnosis and treatment?
So hematocrit measurements are incredibly valuable for diagnosing a range of conditions.
Okay.
For instance, they can help differentiate between the various types of anemia we talked about earlier by looking at the hematocrit level, along with other blood tests.
Right.
Doctors can pinpoint whether the anemia is due to iron deficiency, vitamin B12 deficiency, or another cause.
So it's not just about knowing whether your hematocrit is low.
Right.
It's about understanding.
That's about why.
Why it's low.
Exactly.
Okay, that makes a lot of sense.
Yeah.
Is hematocrit used to diagnose other conditions besides anemia?
Absolutely.
Okay.
Hematocrit is also used to diagnose polycythemia vera, dehydration, and a whole host of other hematological disorders.
Wow.
It's really a foundational piece of information when assessing blood health.
It's remarkable how one simple measurement can reveal so much about what's happening inside the body.
Right.
But I imagine it's not always a clear-cut indicator.
You're right. It's not always straightforward.
Are there any other factors that can influence hematocrit readings?
There are a number of things that can skew hematocrit levels.
Oh, interesting.
Even if there's nothing inherently wrong with your health.
What kind of things can throw off the results?
Well, we already talked about altitude.
Right.
But even temporary changes in your hydration status can have an impact.
Okay.
If you're dehydrated, for example, your hematocrit might appear higher than it actually is because the blood is more concentrated.
Right.
Conversely, overhydration can dilute the blood and make the hematocrit appear lower.
Okay, so staying properly hydrated is key.
Absolutely.
As always.
As always.
What other factors come into play?
Pregnancy is another one.
Okay.
As a woman's blood volume increases during pregnancy, her hematocrit level often decreases due to a natural thinning of the blood.
Right.
It's a normal physiological adaptation to support the growing fetus.
Right. Okay.
Yeah.
Anything else we should be aware of?
Smoking is another factor that can impact hematocrit levels.
Right.
Smoking chronically exposes the body to lower oxygen levels, which, as we discussed earlier, can trigger an increase in red blood cell production.
Right.
Yeah.
So yet another reason to avoid smoking.
Exactly.
Right.
Yeah.
It's fascinating.
It is.
How interconnected all of these things are.
Yeah.
It's like a complex web of cause and effect.
It really is.
And that's why it's crucial to look at hematocrit values in context.
Absolutely.
Right.
You have to consider your overall health history.
Right.
Any other symptoms you might be experiencing.
Yeah.
And lifestyle factors that could be influencing the results.
That's a great point.
Yeah.
It reminds me of what we always say, knowledge is power.
It is.
Right.
Absolutely.
The more you understand about your body and your lab results, the better equipped you are to have informed conversations with your doctor.
Right.
And make decisions about your health.
For sure.
Right.
Absolutely.
That's a great point.
Yeah.
It's all about empowering yourself with information and being an active participant in your healthcare. Well said.
Thank you.
So to summarize,
Yeah.
hematocrit is a powerful indicator of blood health and oxygen carrying capacity. It's important to remember that normal ranges vary based on age and sex.
Yes.
And there are various factors that can influence those readings.
Correct.
Right.
So we've learned that both high and low hematocrit can signal underlying health conditions.
Right.
But it's crucial to interpret those results within the context of your overall health.
Exactly.
And any other symptoms you might be experiencing.
This has been a truly enlightening deep dive.
It has.
I feel like we've only scratched the surface of hematocrit.
Oh, yeah. There's a lot more to learn.
What else is there to explore when it comes to this fascinating little measurement?
One area that's particularly relevant these days is the rise of at-home blood testing.
Yeah.
I'm sure many of our listeners are wondering if those kits can measure hematocrit.
Right.
And if so, how reliable the results are.
That's a fantastic point.
Yeah.
I'm definitely curious about that myself. I'm also wondering if at-home hematocrit tests, even if they're not as accurate as a lab test, could still be useful for tracking trends over time.
That's a good question.
Maybe in conjunction with regular doctor's visits.
Absolutely.
Those are great questions, and I think that's a perfect place to pick up in part 2.
Sounds good.
So we will be back for part 2 of our hematocrit deep dive.
Looking forward to it.
All right, we'll see you then.
See them.
So we were talking about those at-home blood testing kits.
Yes, we were.
Can they actually measure hematocrit accurately?
Well, some of them do. The accuracy can vary.
Got it.
Quite a bit.
Okay.
They might not be as precise as a lab test ordered by your doctor.
Okay.
Where the sample is handled and analyzed
Right.
under very controlled conditions.
So probably not a good idea to rely solely on those.
Probably not.
For major health decisions.
Right.
But could they still be useful in some way?
Sure.
Like for spotting trends over time? Especially if you're getting regular checkups with your doctor.
Yeah, that's a great point.
Yeah.
If you're using an at-home test, it's essential to choose a reputable brand.
Right.
And follow the instructions carefully.
Of course. Yeah.
And as you said, it's crucial to view those results within the context of your overall health.
Right.
And any other factors that might be influencing your hematocrit levels.
So think of it as a data point, not a diagnosis.
Exactly.
Yeah.
At-home tests can be a helpful starting point for a conversation with your doctor.
Right.
But they shouldn't replace professional medical advice.
Okay, that makes a lot of sense.
Yeah.
Before we wrap up,
Sure.
I'm curious to hear your thoughts on how listeners can stay on top of their hematocrit levels
Okay.
and overall blood health.
Okay.
We've touched on a few key points throughout our conversation.
We have.
Are there any specific lifestyle tips?
Well, we've already talked about the importance of hydration.
Right.
How even mild dehydration can affect hematocrit readings.
Right.
So staying properly hydrated is always a good foundation for overall health.
Right.
But beyond that, one of the most important things you can do is focus on a balanced diet.
That's always good advice.
Yes.
But what does a balanced diet specifically look like when it comes to supporting healthy hematocrit levels?
Okay, so
Are there any particular nutrients that we should be paying attention to?
as we discussed earlier, iron, vitamin B12, and folate are all crucial for healthy red blood cell production.
Right.
If you're not getting enough of these nutrients through your diet, your body might struggle to keep up with the demand for new red blood cells, which can lead to anemia and a lower hematocrit.
So it's all about fueling those little red blood cell factories.
Yes, exactly.
What are some good food sources of iron, B12, and folate?
Okay, so when it comes to iron,
Okay.
lean meats, poultry, and seafood are excellent sources.
Okay.
You can also find iron in plant-based foods.
Okay.
Like beans, lentils, spinach, and fortified cereals.
So whether you're a meat eater or a vegetarian, plenty of options.
There are
getting enough iron.
Right.
What about B12 and folate?
Vitamin B12 is primarily found in animal products.
Okay.
Like meat, poultry, fish, eggs, and dairy.
Okay.
If you follow a vegan diet, it's important to include fortified foods or consider taking a B12 supplement.
Makes sense.
Yeah.
And folate.
Folate is abundant in leafy green vegetables like spinach and kale, as well as in legumes, citrus fruits, and fortified grains.
So a diet rich in fruits, vegetables, lean protein, and whole grains is a win-win.
It is.
For overall health and for supporting healthy hematocrit levels.
Absolutely.
And of course, if you notice any unusual symptoms like persistent fatigue, shortness of breath, or pale skin, it's always best to check in with your doctor.
Absolutely. Early detection is always key.
Couldn't agree more.
Yeah.
This has been such an eye-opening deep dive.
It has been.
It's amazing how much we can learn from just one little measurement on a blood test.
It really is.
Hematocrit is like a window into the intricate workings of our bodies.
I like that.
By understanding what it means.
Yeah.
And what can influence it. We can take proactive steps to support our health.
Absolutely. Well said.
Well, that brings us to the end of our hematocrit deep dive.
It does.
I really appreciate you walking us through all of this.
Oh, it was my pleasure.
It's been fascinating.
Yeah, it's a really interesting topic.
And to all our listeners out there, keep those questions coming, keep learning, and until next time, stay curious and stay well.
Stay well.
You know, it's just incredible how even the tiniest parts of our blood can tell us so much about our health.
It really is fascinating, isn't it?
It is. It
is.
Speaking of those tiny components, I'm curious, how does our body regulate hematocrit?
Okay.
Is it constantly making new red blood cells, or is there more to it?
That's a great question. And it speaks to the remarkable balancing act happening inside us all the time.
Right.
Our bodies are constantly monitoring oxygen levels.
Yeah.
And when those levels dip,
Right.
it triggers a cascade of events.
It's like our own internal oxygen sensor.
Exactly.
Yeah.
When oxygen levels drop, our kidneys release a hormone called erythropoietin.
Right.
We touched on this earlier when we talked about kidney disease. And that hormone essentially tells our bone marrow, hey, we need more red blood cells. Step up production.
So the kidneys are kind of like the
Yeah.
The project managers making sure everything is running smoothly.
That's a great way to put it.
Yeah.
And on the flip side, when oxygen levels are sufficient, erythropoietin production decreases.
Right.
And red blood cell production slows down.
It's a beautiful feedback loop.
It is.
That keeps things in equilibrium.
Exactly.
But like any system.
Right.
Sometimes things can go awry, which is when we see those fluctuations in hematocrit levels that we've been discussing.
Yes.
And that's why paying attention to those numbers,
absolutely,
along with any changes in how we're feeling, is so important.
It is.
This deep dive has given us a much deeper appreciation for what goes into maintaining a healthy hematocrit level. We've learned about the importance of hydration, nutrition, and understanding how various conditions and lifestyle factors can impact those tiny red blood cells that carry oxygen throughout our bodies.
For sure.
It's been a pleasure exploring this with you.
It's been fun.
I hope our listeners feel empowered to advocate for their own health.
Absolutely.
And to have more informed conversations with their healthcare providers.
I hope so too.
Well, on that note, I think that brings us to the end of our hematocrit deep dive.
It does.
Thank you so much for joining us.
Thank you for having me.
And to all our listeners out there, keep those questions coming, keep learning, and until next time, stay curious and stay well.
Stay well.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey, one step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.